Good morning, everyone. I'm Dr. Sabiha Banu. I'm Assistant Professor from National Institute of Diabetes and Endocrinology, Dow Oja campus. Today, I will present the diagnosis, classification, and clinical presentation of diabetes. So, what is the definition of diabetes mellitus? It is basically a disease in which the body's ability to produce or respond to the hormone insulin is impaired. This results ultimately in abnormal metabolism of carbohydrates and elevated level of blood glucose. So let's review what are the causes of diabetes mellitus. Too much glucose circulating in blood stream causes diabetes regardless of the type. However, the main reason why blood glucose levels are high differs depending on the different types of diabetes mellitus. Insulin resistance. Type 2 diabetes mainly results from insulin resistance. So what is basically insulin resistance? This insulin resistance happens when the body's cells in the muscles, fat and liver do not respond as they should respond to the insulin. Several factors and conditions which contribute to the insulin resistance are obesity, lack of physical activity, dietary changes, hormonal imbalances, genetics, and certain medications. Autoimmune diseases. Type 1 diabetes and latent autoimmune diabetes of adults happen when the body's own immune system attacks the beta cells of pancreas. We all know the beta cells of pancreas are very important for producing the insulin and controlling the blood glucose level. Hormonal imbalances, like we see in pregnancy, the placenta releases hormones that are responsible for causing the insulin resistance. Females may develop gestational diabetes if pancreas can't produce enough insulin to overcome the insulin resistance. Ultimately, this leads to the hyperglycemia in pregnant mother. Other hormonal conditions like acromegaly, Cushing syndrome, in which there is excess of the cortisol, can also cause the type 2 diabetes mellitus. Then, pancreatic damage in the form of any condition like surgery, diseases related to pancreas like cystic fibrosis can impact the ability of pancreas to make insulin, ultimately results in diabetes. There are certain genetic mutations which can cause the MODY. MODY is basically maturity onset of diabetes in young and neonatal diabetes. Then we have the drug-induced diabetes mellitus, like long-term use of certain medications leads to type 2 diabetes mellitus, like the drugs which are used for treating the HIV, cyclosporin, and corticosteroids. So we should take the drug history, detailed drug history of the patients who present to us with the diabetes. So now let's come on the classification of diabetes. First is type 1 diabetes, which is happening in 5 to 10% of cases, total cases of diabetes mellitus. This is basically an autoimmune condition in which the body's own immune system destroys the insulin producing beta cells in the pancreas, leading to absolute deficiency of insulin. So ultimately hyperglycemia occurs. What are the symptoms of type 1 diabetes mellitus? It develops quickly. The symptoms include weight loss, fatigue, and polyuria and polydipsia. So this is the pictorial representation of type 1 diabetes. The normal pancreas in a normal person who doesn't has the type 1 diabetes produces enough amount of insulin according to the blood glucose level. This insulin goes to the blood vessels and then ultimately this insulin acts on the insulin receptors which are basically on the body cells to control the blood glucose level. What happens in type 1 diabetic patient? The pancreas is not producing enough insulin due to the loss of beta cells. So there is deficient insulin level in the blood vessels, ultimately leads to hyperglycemia and ultimately lead to the symptoms of polyuria, polyphagia, weight loss. Now come to the next type, which is more common, which occurs in 90% of the diabetic patient. This type is more common than type 1. This is type 2 diabetes mellitus. In this, the body either does not uses insulin properly, which we call as insulin resistance, or the pancreas is not producing the enough insulin. What are the risk factors for having type 2 diabetes mellitus? Overweight, lack of physical activity, genetics, and family history. The symptoms of type 2 diabetes are often milder than the type 1 diabetes, leading to a delayed diagnosis. But with a high level of blood glucose levels, patient might develop polydipsia, polyuria, and weight loss. The treatment of type 2 diabetes mellitus include lifestyle changes, diet and physical activity, and medications, oral hypoglycemic agents, and insulin. Next type is gestational diabetes mellitus, which is called as GDM. High blood glucose level first detected during pregnancy, usually in the second or third trimester, or at any time during the pregnancy for the first time. This is labeled as gestational diabetes mellitus. Its management requires lifestyle changes and medications like insulin or the metformin, depending on the blood glucose severity. You have to choose it. The outcomes of gestational diabetes, it often resolves after birth, but the future risk of having the diabetes increases for both the mother and the child. What are the other types of diabetes mellitus? Monogenic diabetes. It is caused by single gene mutation. The examples include the maturity onset diabetes of young, that is called as MODY, and neonatal diabetes, which is called as NND. There are other specific causes of diabetes which are labeled as secondary diabetes. So what are the causes of secondary diabetes mellitus? The types like genetic defects of beta cell function, as we reviewed, maturity onset of diabetes of young MODY, mitochondrial DNA mutations, neonatal diabetes. Then we have the genetic defects of insulin action, which also causes secondary diabetes. These include lipodystrophies, insulin receptor mutations like type A insulin resistance, leprogenism, Repson-Mendel syndromes. Rare downstream insulin signaling defects causes the secondary diabetes. Monogenic obesity or hyperphagia, which is basically because of the leptin deficiency. This also ultimately leads to secondary diabetes. There are a couple of diseases of exocrine pancreas like pancreatitis, trauma to the pancreas, pancreatectomy, pancreatic malignancies, pancreatic destruction due to certain diseases like cystic fibrosis, hemochromatosis. These also ultimately leads to the secondary diabetes. Then we have endocrinopathies like Cushing syndrome, the condition because of the excess cortisol level, acromegaly, one endocrine condition which is basically because of the excess of growth hormone release, uh, glucagonoma, hyperthyroidism, autoimmune polyendocrinopathy syndromes type 1 and type 2. Then we have drug-induced diabetes because of the use of the glucocorticoids, thyroid hormone, diazoxide, beta-adrenergic agonists, thiazide diuretics, interferons, antiretroviral treatment. Certain infections can also cause the secondary diabetes like congenital rubella, cytomegalovirus infections, and others. There's uncommon form of immune-mediated diabetes which is called as the Stiffman syndrome. In this, the patient presents with type 1 diabetes, rigidity of muscles, painful muscle spasms, and there are insulin receptor antibodies. Other genetic syndromes associated with diabetes include Klinefelter syndrome, Turner syndrome, Down syndromes, Wolfram syndrome, Friedreich ataxia, Huntington's chorea, ciliopathies, myotonic dystrophy, and others. So these are basically the causes of secondary diabetes. Now we will review what are the symptoms of diabetes mellitus. Increased thirst, that is called as polydipsia, dryness of mouth. These basically occur because of the increased blood levels of glucose. Frequent urination, polyuria, fatigue, having the blurred vision because of the high blood glucose levels, explain weight loss. unexplained weight loss, numbness or tingling in the hands or feet, slow healing wounds or cuts, frequent skin infections, or the vaginal candidiasis. We should think of when we have the patient with these symptoms, we should order the glucose levels. So this is the pictorial representation of how the symptoms of diabetes present. The patient might have the increased thirst, slow healing wounds, having the fatigue all the time, blurred vision, frequent urination. The severity of symptoms can vary based on the type of diabetes mellitus. These symptoms are usually more robust in patients with type 1 diabetes than in type 2 diabetes. This is the pictorial representation of the symptoms of diabetes mellitus. Patient always feeling tired, having hungry, sexual problems, always having the feel of excessive thirst, numbness or tingling in the hands and the feet, frequent urination, polyuria, unexplained weight loss, wounds that are not healing on time, blurred vision, and the recurrent vaginal infections. If you have some of the above symptoms, you are recommended to consult to your doctor so that the investigation can be done so as the diabetes can be diagnosed appropriately on time. Next is how to have the diagnosis of diabetes mellitus. How to diagnose if a patient presents with these symptoms. The type of test I will tell you: the fasting blood glucose, random blood glucose, and the HbA1c. So let's see what are the targets for these. Fasting blood glucose target: if less than 100 it's normal. If random blood glucose less than 200 is normal. HbA1c less than 5.7 is taken as normal. If a patient has the fasting blood sugar of 100 to 125 milligram per deciliter, then it is labeled as pre-diabetes. If the HbA1c is 5.7 to 6.4, it is labeled as pre-diabetes. In diabetic patient, the fasting blood glucose is 126 or more, and the random is 200 or more, and the HbA1c 6.5 or higher is labeled as the diabetes mellitus. So what are the differences between type 1 diabetes mellitus and type 2 diabetes mellitus? This slide is very important. We should know how to differentiate between these types of diabetes mellitus. Basically, type 1 diabetes present in the initial years of life, peak ages initial first few years of life. Type 2 diabetes is seen at more advanced age and the middle age, but now with the rising epidemic of obesity, we are do seeing the adolescent patients having the type 2 diabetes mellitus because of the rising pandemic of obesity. The prevalence of type 2 diabetes is more as compared to type 1 diabetes. Initial presentation of type 1 is with the robust symptoms: polyuria, short history, polyuria, polydipsia, unexplained weight loss, ketosis. In type 2 diabetes mellitus, we have the hyperglycemic symptoms, often with the complications of diabetes. The etiology in type 1 is autoimmune beta cell destruction of pancreas, and in type 2, the combination of insulin resistance, beta cell destruction, and the beta cell dysfunction. They are not able to produce enough insulin to combat the levels of blood glucose. In type 1 diabetes mellitus, we have the presence of beta cell antibodies in more than 90% of the patients. In type 2 diabetes mellitus, there are no presence of beta cells antibodies. Type 1 patients are insulin deficient. Type 2 diabetes mellitus patients are insulin sufficient, but they can develop the insulin deficiency after many years, like 8 to 10 years of diagnosis of type 2 diabetes mellitus. DK is more commonly seen in type 1 diabetic patient, but we do see DK in type 2 patients also if they are non-compliant with the insulin, they're missing the doses of their oral hypoglycemic and insulin. Obesity is uncommon in type 1 diabetic patients. Type 1 diabetic patients are usually lean and thin, while type 2 are mostly obese. Insulin resistance is common in type 2 diabetes mellitus and it's uncommon in type 1 diabetes mellitus. Treatment of type 1 is only the insulin from the onset of the diagnosis of disease. No role of oral hypoglycemic agents in type 1. Remember this point. This point is very important. In type 2 diabetes mellitus patient, if the patient has the weight loss and ketotic symptoms, initially we start with the insulin and then we switch the patient with the oral hypoglycemic agents. The oral hypoglycemics are most commonly used in type 2 diabetes mellitus. This is all from my side for today's presentation. Thank you.